Monocarboxylate transporter 1 deficiency and ketone utilization. Ketoacidosis. Ketoacidosis is a potentially lethal condition caused by the imbalance between hepatic production and extrahepatic utilization of ketone bodies. What is ketoacidosis?
Ketoacidosis is a crisis in type 1 diabetes, where either you run out of insulin completely, you forgot to take a few shots, or you didn't know that your insulin had gone bad, so you run out of insulin, or there's an overwhelming stress that happens, heart attack, pneumonia, where the amount of insulin you need as a stress hormone is huge and you're not getting enough. It is a hospitalizable emergency. Typically, you only really know it, if you're not checking yourself all the time, when you begin vomiting and find that you just can't control yourself. And by that time, you can't rescue yourself at home. So if you have type 1 diabetes on insulin, and there's a big illness that you're experiencing where you run out of insulin and you begin vomiting, that's a medical emergency, and there's nothing you could do at home other than drink as much fluids as you can, have someone get you to the ER.
The clinical consequences of ketoacidosis are exemplified by diabetic ketoacidosis, a condition that is marked by vomiting, osmotic diuresis, dehydration, and cosmal breathing, and that may progress to decreased consciousness and ultimately death. We perform exome sequencing in a patient with recurrent severe ketoacidosis and identified homozygous frameshift mutation in the gene encoding monocarboxylate transporter 1.
Ketoacidosis is a metabolic state associated with high concentrations of ketone bodies, formed by the breakdown of fatty acids and the deamination of amino acids. The two common ketones produced in humans are acetoacetic acid and I-squared-hydroxybutyrate. Ketoacidosis is a pathological metabolic state marked by extreme and uncontrolled ketosis. In ketoacidosis, the body fails to adequately regulate ketone production, causing such a severe accumulation of keto acids that the pH of the blood is substantially decreased. In extreme cases, ketoacidosis can be fatal. Ketoacidosis is most common in untreated type 1 diabetes mellitus, when the liver breaks down fat and proteins in response to a perceived need for respiratory substrate. Prolonged alcoholism may lead to alcoholic ketoacidosis. Ketoacidosis can be smelled on a person's breath. This is due to acetone, a direct byproduct of the spontaneous decomposition of acetoacetic acid. It is often described as smelling like fruit or nail polish remover. Ketosis may also smell, but the odor is usually more subtle due to lower concentrations of acetone. Etiology: two common types are diabetic and alcoholic ketoacidosis. In diabetic patients, ketoacidosis is usually accompanied by insulin deficiency, hyperglycemia, and dehydration. Particularly in type 1 diabetics, the lack of insulin in the bloodstream prevents glucose absorption and can cause unchecked ketone body production, potentially leading to dangerous glucose and ketone levels in the blood. Hyperglycemia results in glucose overloading the kidneys and spilling into the urine.
Conclusion: mutational status was found to be correlated with ketoacidosis severity, MC21 protein levels, and transport capacity.